Hi, I'm Liz Peña, and I'm going to be talking about dynamic assessment today. So, what is dynamic assessment? First, my speaker disclosure is that I am a professor and associate dean of faculty development and diversity at the University of California at Irvine, and I'm receiving compensation from the American Speech and Hearing Association for this module. So, today we're going to talk about how we compare dynamic assessment to other dynamic assessment approaches or to other assessment approaches. We're going to talk about what makes dynamic assessment dynamic and what we should use as the dynamic assessment pre-test and post-test. Also, we're going to consider how dynamic assessment differs from assessments including standardized assessment, observations, and response to intervention. Some overlap, but there are some differences as well. So what makes dynamic assessment dynamic? Well, one of the things that makes it dynamic is that the focus is more on the learning process rather than on how kids perform on a standardized test or a probe. So it's really important to be observant of what children are doing during that learning. We look at the amount and nature of the examiner investment. So how hard did somebody have to work to get that kid to make some changes? It's very interactive, so you make decisions in the moment about what might help the child perform at a higher level. And we're really focused on the process rather than on child outcomes. In terms of selecting a test, what you want to do is select a probe or a measure that really samples the language skills of interest. We want it to be something that is sensitive to short-term changes. So a lot of examples of a certain kind of item, for example, might be a better way of probing a child language skill than a broad-based measure. And we want to be able to capture emerging knowledge and performance. So it's not, I want to be able to rate something on like a scale. Is it close to the target? Is it exactly the target? Is it completely different from the target? So that helps us to capture what children are learning in a very short amount of time. So how do dynamic assessment approaches differ from other approaches? Well, here's a chart that shows a summary of some of these. So for standardized assessment or static assessment, participants are passive. So you go in, you test, and you're not supposed to interfere with the child's performance or with the child's answers. You're not supposed to cue them. So the examiner has a very neutral stance on what they're doing. The examiner's role is to really observe what the child can do pretty independently. Standardized tests are also used to describe needs or areas of difficulty, and it's given in a really standardized way so that you give that measure the same way every time you give it to a different child. In dynamic assessment, it's a little bit different. So both the child and the examiner are really active, and the examiner is actively participating and intervening and supporting the child learning during that language assessment. So you're watching and hypothesizing and then getting in there and trying to make that child's performance a little bit better. The goal is to describe modifiability or how the child can change. And so the protocol is really flexible and adaptable. So you have permission to go off script and to make hypotheses about what you think the child's needs are, try to do a mini support for that process or that procedure, and then see how they do with that. So how is dynamic assessment different from observation? So observation is a really important aspect of assessment, but in observation, usually examiners are more neutral. So you're kind of in the room, observing, watching, and developing hypotheses about what happens and why that happens, and it helps you to compare performance across contexts. In dynamic assessment, examiner is going to be more active, and so they may get into the child's space to intervene to try to help the child perform better on a specific linguistic task. So that's one difference from observation. How is dynamic assessment different from response to intervention? And response to intervention, I think, has a lot of similarities to dynamic assessment. So we look at child responsiveness in both, we look at child learning in both, we want to document intervention that leads to change in both, and we look at outcomes in both. But where they differ is in the approach. So dynamic assessment starts with testing and then teaching and retesting. In response to intervention, the focus is more on teaching and then testing and then reteaching. In terms of the number of sessions, dynamic assessment uses relatively few sessions. So you're just trying to look at emerging knowledge or ability to change, and you do it in 1, 2, or 3 sessions typically. Response to intervention is usually over several weeks, so 10 weeks, 15 weeks, a whole semester. And so you're looking at whether children are retaining that information and using the information that they're learning. Dynamic assessment can be used or is typically used in special education to determine whether a child has a language impairment or a developmental language disability. And RTI is used as a tiered intervention within the regular education domain. And then the focus is a little bit different. In dynamic assessment, we look at what works and why it works that way. And in response to intervention, we're looking at what tier or what level of support works best for that child. So now we've explored the concept of dynamic assessment, and in the next activity, we're going to review some examples of these concepts. So what is dynamic assessment? Let's review some examples. So here we have a girl, Vicky. She's 6 years old and she's in the 1st grade. Her teacher referred her to the speech language pathologist because she's concerned about her language and literacy skills. The speech language pathologist gives her the test of narrative language. The scores indicate difficulty with narrative comprehension and narrative production. What is this? So this is an example of a static test. So it's a standardized test. The examiner administers the test according to the manual, same way that you would give it to any child, and you score the stories and the questions, and you obtain a standardized score for comprehension and for production, and then like a more comprehensive score as well. And this score helps us to determine whether the child has a developmental language disability. Next, SLP might observe Vicky during reading instruction, and she notices that Vicky has difficulty decoding words. So here, the speech pathologist is doing an observation. So through these observations, she's able to make hypotheses about Vicky's instructional needs that are based on observations, that are based on what she sees in the classroom setting. Next, we find out that Vicky tests in the lowest quartile on a reading test, and the school recommends Vicky for the early interventions in reading program that's focused on letter sound knowledge, reading fluency, and curricular vocabulary. And so this is a standard curriculum that's a tier 2 curriculum. And after 16 weeks, she's going to be retested to see if she's on target for reading. So this is an example of response to intervention. The 16-week program is a 2-tier intervention that's focused on getting Vicky's skills up to speed. And then the SLP notices also that Vicky's TNL stories are not well organized. And so the SLP works on stories that include elements to include a problem statement, an attempt, and a resolution. She observes and reports on Vicky's strategies during that teaching session and the kinds of supports that she needs to improve her stories. And this is an example of dynamic assessment. So the focus is on the process of learning and what the child needs in order to make changes in her story. So in the next 5 minutes, what you need to do, or what is planned for you to do, is your turn to practice. So here's a plan statement. So what you want to think about: the who, the what, and the how. And think about a child that you're currently testing or have tested recently. Is there a diagnostic question that you can answer using dynamic assessment? What is the focus of the concern? And what are your hypotheses regarding how best to support learning in this area? And then how can you test this out using principles of dynamic assessment? Let's try your plan. So spend 5 minutes at work putting your plan into action. So dynamic assessment can be really powerful to determine what works, what doesn't work, why a child might be having difficulty, and you use the dynamic assessment to test that out. If you don't have somebody that you're working with right now that this could work for, maybe explain this process to a colleague. How can they use dynamic assessment to differentiate between language difference and language disorder? And here you might jot down some reflections. What went well in your plan? What happened? How can you make improvement? So think about what your teaching target was. How did you test and retest? What was the child's response to that teaching? What did they pick up on? What was difficult? What else do you need to know to make a diagnostic decision? How does it inform your testing?